When you sit down at the end of the day and your legs feel like they're filled with concrete, your first thought is probably that you've just been on your feet too long. And maybe that's true, but what most people don't realize is that heaviness in the legs at night, especially when it happens regularly, can be your body's way of telling you something important about your circulation, your nervous system, and the health of the tissues deep inside your lower extremities. I've spent over 3 decades working with patients who come in describing exactly this sensation. They tell me their legs feel weighted down, sluggish, sometimes achy or swollen by evening. Many of them assume it's just age or that they need to exercise more, or that it's nothing to worry about. And for some people, that's correct. But for others, this nightly heaviness is an early warning sign of changes happening beneath the surface. Changes that, if left unaddressed, can progress into something far more limiting. So before you dismiss those heavy legs as just another inconvenience of getting older, I want to walk you through what's actually happening in your body when this occurs, why nighttime matters, and what you can do about it while the situation is still in your control. Let's start with the mechanics. Your legs are the hardest working part of your circulatory system. Think about it. Blood has to travel all the way down from your heart to your feet, deliver oxygen and nutrients to every cell along the way, and then fight gravity to make the return trip back up. That return journey depends on a remarkably elegant system that most people never think about until it stops working efficiently. Inside your leg veins, you have a series of one-way valves. These valves open when blood flows upward toward your heart, and they snap shut to prevent backflow. But the valves don't work alone. They rely on something called the muscle pump. Every time you contract your calf muscles, whether you're walking, standing on your toes, or even just shifting your weight, those muscles squeeze the deep veins and push blood upward. It's like a biological conveyor belt, constantly cycling fluid back to your heart. Now here's what happens by the end of the day. If you've been sitting for long periods, standing in one position, or even walking in a way that doesn't fully engage those calf muscles, that muscle pump becomes less effective. Blood starts to pool in the lower legs. The pressure inside those veins increases. Fluid begins to leak out of the vessels and into the surrounding tissue. Clinically, we call this venous insufficiency in its early stages, but you experience it as heaviness, achiness, and sometimes mild swelling. Research from institutions like the Mayo Clinic and studies published in journals such as Circulation have shown that even in people without diagnosed vein disease, prolonged periods of inactivity cause measurable changes in venous pressure and fluid distribution. By evening, the cumulative effect of gravity and reduced muscle activity creates that weighted sensation. But circulation is only part of the story. Stay with me, because this next part is important. Your nervous system also fatigues throughout the day. The nerves that control muscle tone, coordination, and proprioception, which is your body's sense of where it is in space, are constantly firing signals. By nighttime, especially if you've been physically or mentally stressed, those signals can become less crisp. The result is a kind of low-grade neuromuscular exhaustion. Your legs don't just feel heavy because of fluid accumulation. They feel heavy because the communication between your brain and your leg muscles is running at lower efficiency. This is where most people get confused. They think of fatigue as purely muscular, like sore legs after a workout. But neurological fatigue is different. It's a dulling of responsiveness, a lag in the feedback loop between sensation and movement. And it compounds the circulatory problem, because when your muscles aren't receiving strong, consistent nerve signals, the muscle pump I mentioned earlier becomes even less effective. Now let's talk about what changes as we age, because this is critical to understanding why heavy legs at night tend to become more common after the age of 40 or 50. As you get older, the walls of your blood vessels naturally lose some of their elasticity. They become stiffer, less responsive to changes in pressure. At the same time, the valves inside your veins can start to weaken or become damaged, especially if you've had prolonged periods of standing, multiple pregnancies, or a sedentary lifestyle. The National Institutes of Health have documented that venous valve competence, meaning how well those valves close, declines with age in a significant percentage of the population. Simultaneously, muscle mass begins to decrease, particularly in the lower legs, if you're not actively working to preserve it. Less muscle means a weaker pump. Less muscle also means less metabolic activity in the tissues, which affects how efficiently your body clears waste products and excess fluid from the area. Add to this the fact that nerve conduction velocity, the speed at which electrical signals travel through your nerves, also slows slightly with age. So you have stiffer vessels, weaker valves, reduced muscle mass, and slower nerve signals, all converging to make that end-of-day heaviness more pronounced. But here's the thing. This progression is not inevitable. It's modifiable. And the earlier you recognize what's happening, the more options you have to intervene. Let me be very clear about something. Feeling heaviness in your legs at night after a long day of activity is normal. It's a sign that your body has been working and needs rest. What's not normal is when that heaviness is disproportionate to your activity level. When it's accompanied by visible swelling, skin changes, persistent cramping, or when it starts to interfere with your ability to sleep or move comfortably. Those are the distinctions that matter clinically. If your legs feel moderately heavy after you've been on your feet for 10 hours, that's expected. If your legs feel unbearably heavy after you've been sitting at a desk all day, that's a signal worth paying attention to. So what can you do about it? Let's talk about evidence-based approaches that address both the circulatory and neurological components of this problem. The single most effective intervention, and this is supported by decades of research, is regular movement that activates the calf muscle pump. I'm not talking about intense exercise. I'm talking about deliberate, consistent engagement of the muscles in your lower legs throughout the day, and especially in the evening. One of the simplest and most effective movements is the ankle pump. You can do this sitting or lying down. Point your toes away from you. Hold for 2 seconds. Then pull your toes back toward your shin. Hold for 2 seconds. Repeat this 20 to 30 times. What you're doing is manually activating that muscle pump, pushing blood and fluid back up toward your heart, reducing the pooling that causes heaviness. Another approach is leg elevation. When you elevate your legs above the level of your heart for 15 to 20 minutes, you're using gravity to assist venous return instead of fighting against it. This is particularly effective if done in the evening before bed. Research has shown that even brief periods of elevation can significantly reduce venous pressure and fluid accumulation. Compression is another tool, though it requires some understanding. Graduated compression garments, meaning socks or sleeves that are tighter at the ankle and gradually looser toward the knee, work by externally supporting the veins and reducing their diameter. This makes the valves more competent and helps prevent backflow. Studies published in journals like Phlebology have demonstrated that properly fitted compression reduces leg heaviness and swelling in people with early venous insufficiency. But compression isn't a one-size-fits-all solution. The amount of pressure matters. Too little, and it's ineffective. Too much, especially if you have underlying arterial disease, and it can be harmful. This is why I always recommend consulting with a healthcare provider before starting compression therapy, particularly if you have any history of cardiovascular issues. Now let's address the neurological component. The nervous system, like any system, responds to stimulation and rest. Activities that challenge your balance and proprioception, standing on one foot, walking heel to toe, even simple yoga poses like tree pose, send strong signals through the nerves in your legs and help maintain their responsiveness. What many people don't understand is that the nervous system needs variety in its stimulation. When you perform the same movements day after day, the nerves become habituated. They stop responding as vigorously. This is why introducing new types of movement, even simple variations like walking backwards for a few steps or standing on an unstable surface, can wake up dormant neural pathways and improve overall leg function. Equally important is sleep quality. During deep sleep, your body clears metabolic waste from the nervous system, repairs tissue, and resets neuromuscular pathways. Poor sleep directly impacts how your legs feel the next day and how they respond to fatigue by evening. This is an area where people often overlook the connection, but clinically, we see it constantly. Patients who improve their sleep hygiene often report reduced leg heaviness without making any other changes. The relationship between sleep and leg health is actually bidirectional. Poor circulation can disrupt sleep through restless legs or nighttime cramping, and poor sleep worsens circulation by increasing inflammation and reducing the body's ability to repair vascular tissue. Breaking this cycle requires attention to both elements simultaneously. Hydration and nutrition also play roles that are more significant than most people realize. Dehydration reduces blood volume, which makes the heart work harder and reduces the efficiency of venous return. Electrolyte imbalances, particularly low potassium or magnesium, can contribute to muscle cramping and that heavy, sluggish feeling in the legs. These are modifiable factors that don't require medications, just awareness and consistency. There's also the question of what happens if you ignore this. Let me walk you through the progression, not to alarm you, but to help you understand why early attention matters. In the early stages, you have mild heaviness and occasional swelling. The veins are working, but not optimally. At this point, simple interventions like movement, elevation, and lifestyle adjustments are usually enough to prevent progression. If the condition continues without intervention, the chronic pooling of blood and fluid starts to cause secondary changes. The skin around the ankles may become discolored, developing a brownish tint from hemosiderin deposits, which are breakdown products of red blood cells that leak into the tissue. The skin may become dry, itchy, or inflamed. This is called stasis dermatitis, and it's a sign that the tissues aren't getting adequate circulation. As the valves weaken further and the veins become more dilated, you may develop visible varicose veins. These aren't just cosmetic issues. They represent structural changes in the venous system. The veins become tortuous, the valves become incompetent, and the muscle pump becomes increasingly ineffective. In advanced cases, chronic venous insufficiency can lead to venous ulcers, which are open sores that form near the ankles and are notoriously difficult to heal because of the poor circulation in the area. These require medical management and can significantly impact quality of life. I'm not sharing this to scare you. I'm sharing it because the trajectory from mild heaviness to advanced disease is not a straight line. There are multiple points where intervention can change the course. And the earlier you intervene, the simpler and more effective those interventions are. Now, let me address something that comes up frequently. People ask me, how do I know if my leg heaviness is from veins or if it's something else? How do I know if I should be concerned? This is a fair question, and it's one that requires some clinical judgment. Heaviness from venous insufficiency typically worsens as the day goes on, improves with elevation, and is often accompanied by visible swelling, especially around the ankles. It tends to be bilateral, meaning both legs, though one side can be worse than the other. Heaviness from arterial disease, where the problem is blood flow to the legs rather than blood flow from the legs, tends to be triggered by activity and relieved by rest. It's often described as cramping or pain in the calves when walking, a condition called claudication. If you have this pattern, you need vascular evaluation promptly. Heaviness from neurological conditions, such as peripheral neuropathy, is often accompanied by numbness, tingling, or burning sensations. It may not follow a predictable pattern related to time of day. If you have these symptoms, particularly if you have diabetes or a history of nerve issues, that also warrants medical assessment. Heaviness from musculoskeletal problems like arthritis or muscle strain tends to be localized, activity-related, and associated with joint pain or stiffness. The point is, while heavy legs at night are commonly related to venous and neuromuscular fatigue, they're not always. If you're unsure, or if you have risk factors like diabetes, smoking, obesity, or a family history of vascular disease, don't guess. Get evaluated. But for many of you watching this, what you're experiencing is that early stage venous and neuromuscular fatigue I described. And for that, the strategies I've outlined, movement, elevation, compression if appropriate, attention to sleep and hydration, are the foundation of management. Let me give you something practical you can assess at home, not as a diagnostic test, but as a way to gauge how your legs are functioning. Sit on the edge of a chair with your feet flat on the floor. Now lift your heels off the ground and rise up onto the balls of your feet using just your calf muscles. Hold for 2 seconds, then lower slowly. Can you do this 20 times without significant fatigue or cramping? Can you do it smoothly with control? If you can, that suggests your calf muscle pump is functioning reasonably well. If you struggle, if your calves cramp, or if you feel wobbly and uncoordinated, that tells you those muscles and the nerves controlling them need attention. Another simple check. Press your thumb firmly into the front of your shin for about 5 seconds, then release. Does the indentation remain for more than a few seconds? If it does, that's called pitting edema, and it indicates fluid retention. It doesn't automatically mean you have a serious problem, but it does mean your body isn't clearing fluid efficiently from that area. These aren't definitive tests. They're observations. But they give you information about what's happening in your own body. Here's what I want you to take away from this. Heavy legs at night are common, but common doesn't mean unimportant. Your body is giving you feedback. The question is whether you listen to it while the situation is still manageable, or whether you wait until the symptoms become limiting. The vascular and nervous systems in your legs are resilient. They respond to intervention. Movement improves the muscle pump. Elevation reduces venous pressure. Proper sleep supports nerve health. Hydration optimizes blood volume. These aren't complicated interventions, but they require consistency. And here's the hopeful part. Even if you've had heavy legs for years, improvement is possible. I've worked with patients in their 60s and 70s who thought their symptoms were just part of aging, and who saw significant improvement once they started addressing the underlying mechanics. It's not about reversing every age-related change, it's about optimizing the function you have. If you're watching this and recognizing your own experience, I'd encourage you to think about what patterns you're noticing. How long have your legs been feeling heavy? Is it every night or only after certain activities? Have you noticed swelling, skin changes, or cramping? These details matter, and they're worth discussing with a healthcare provider if you haven't already. The legs carry you through life. They deserve attention before small problems become bigger ones. Heaviness at night is your body's way of asking for that attention. And now that you understand what's happening beneath the surface, you're in a much better position to respond effectively. Thank you for staying with me through this explanation. I hope it's given you clarity, and more importantly, I hope it's given you a sense of agency. This is not something that just happens to you. It's something you can influence.